The goal of this project is to shift understanding and practice of solidarity in global health. And as you know, during health crisis and other forms of crisis, people are often appeal to solidarity. However, the nature of the concept and what it means in practice can sometimes be debated, and it is very difficult to pin down. So part of our work is to acquire a better understanding of solidarity and see how we can transform this into actionable goals that can generate a sort of index that will hold actors accountable to in the practice of solidarity in global health. And we're doing this using a method of pluriversality, which is exploring from different parts of the world and different understandings, hopefully to be able to find some common traits that will help us to draw these actionable goals and the index for measuring solidarity. We have been holding workshops in different parts of the world. And next slide, please. And as you will see, our researchers are spread across the globe. We've had workshops in India, in Australia, in Costa Rica, in Ghana, in Guinea, and we will soon be holding another workshop in South Africa. And with these, we will come up with some actionable goals. And then with these actionable goals, we'll design the tools that will be used to measure solidarity. And this part is about looking at the lived experiences of refugees and how they perceive solidarity or how they receive or enact solidarity and where it is absent or where it is problematic. We have Thomas Osten-Sacken. He's the co-founder and managing director of a German-Iraqi NGO active in the Middle East since 1991. And under his leadership, WADI supports initiatives against all forms of violence and in favor of democratization, self-empowerment, and free media. And he has worked extensively in Iraq, Syria, Greece, and Germany. He's also an author and a journalist. Now, we know that situations of refugees are usually triggered quite often either by a political situation or perhaps a natural disaster that happens that makes people to become displaced. Here, our focus is not so much on the political cause, but we're looking at the lived experiences of these displaced persons. The first question I wanted to ask Thomas is this: when it comes to refugee health, what forms of misappropriated or unsolidarity or real solidarity do you see? I mean, you've heard these presentations. How do these reflect within the lived experience of refugees, since you are so embedded in the life and experiences of refugees?
Well, it's a question for a book. But I think we have to separate about two very important points. One is kind of health, and the other one is mental health. So we shouldn't, I think it's very important if we start with the latter, that today 70% of traumatic experiences people who fled experience are during flight. That was different in the past. So in the past, you had survivors of torture, imprisonment, political repression. So this was the main reason they had mental health problems. Today, due to this prolonged flight, with a lot of very traumatic experiences, passing the Mediterranean Sea, being in detention camps, living under very, very bad conditions, 70% of mental health problems are occurring during the flight. So this is one of a very major issue. The way refugee policy or anti-refugee policy is conducted, mainly by the European Union, but the same is true for the United States and a lot of countries that are like these transit countries now on the way from the countries of origin to Europe, produce mental health problems. So this is a very big issue. The second is health is not considered a right. I mean, when we're talking about solidarity and everything, and refugees, I'm always saying, well, the refugees are not, shouldn't be an object of charity, of help. They have rights. That's the basic idea of the Geneva Convention. And one basic right is the right for food, health, and shelter. And wherever you look, especially in these transit camps, and I was working during Corona in these camps, uh, this wasn't considered a basic right. It was just considered something some NGOs were dealing with, and a question of charity. So, if we talk about refugees, I would say the first step to reflect on solidarity is to see them as people who should have rights because they lost all their rights uh, as citizens of their countries. So, a approach on public health has to be rights-based, like everything else when we deal with refugees. Kind of an outstanding example how it shouldn't be, how solidarity shouldn't look. Because these very unskilled NGOs dealt with very relevant central health aspects. I mean, in you would never kind of have a volunteer working with heavily traumatized children. You just came from your university studies somewhere in Europe, 23-year-old, and suddenly we're dealing with issues you're neither skilled in, nor do you have the professional background. And I think here, and we worked extensively on that problem. I think here a wrong concept of solidarity even violated basic rights, and that helped the repressive policy. It made the whole issue quite cheap, and it helped to create this image of refugee camps as really hellholes, which are part of the European policy to try to eliminate what they call pull factors. So the worse the situation in a refugee camp looks like, that's the hope, the less people come from the other side of the Mediterranean.
Great. Thank you very much. I think that is quite illustrative, and I like the way you link up, solidarity with human rights as well, because at the end
Well,
of
not human rights.
right, right,
Human rights are, I want to quote, sorry if I
right.
interrupt you.
Yes, yeah,
I'm
go ahead.
very much, I very much want to insist
Mhm.
that refugees don't have human rights. Refugees have rights granted by the Geneva Convention, by the European Declaration of Human Rights, and these are rights that should put them equal to citizens in a country. So it's much more than human rights. And the whole discussion about refugees should always put in the forefront the fact that the attempt of the Geneva Convention is to turn refugees into holders of basic rights. And public health is a basic right.
Right. Yes. And so that brings me to the next question, which I just wanted to mention. And Barbara, feel free to come in as well. The next question is when it comes to support, right, for refugees, how do you discern or distinguish between solidarity and other concepts like, charity or philanthropy that are often used in that space as well?
Well, I would say what we practically are doing. I mean, what we always try to do is help refugees to organize themselves. So the usually also a lot of NGOs and solidarity groups do behave as if someone who passed from point A to point B lost all its capabilities. When you scan a refugee camp, there are doctors, there are engineers, there are car mechanics. So the basic idea should be, and that's even the original idea of the UNHCR, let people organize themselves according to their knowledge and skills. Open up refugee camps, create schools, use teachers for teaching kids language courses and everything. The approach, which was really the worst example I've ever seen in my life, in a lot of places, is total paternalistic approach. Like women ask us, do they think we are unable to clean our own place? We just need the rubbish bags we don't have, otherwise we are going to clean it up. So there is a kind of circle. You make people dependent on help. You create images of dirty refugee camps, of kind of lazy people, which help a very negative image of refugees through certain initiatives of NGOs that, by the way, earn loads of money with the pictures of poor children, etc. pp. So a lot of these organizations even don't have a big interest in fundamentally changing the situation on the ground. So solidarity has to start, in my opinion, A, with this, what I spoke about, rights-based approach, and B, with dignity. I mean, this was a word that I also missed in the kind of former presentations. So what have you lost as a refugee? You have lost your home, you have lost your rights, you have lost whatever, maybe family members. And what is the first step that you need to regain is dignity. Dignity is more important than food, shelter. Dignity is the center of any approach we should follow. And that's what we always try to do also with this with the approach to help people to organize themselves. That's what we did, and I mean, it's very much related to the topic today. For example, in Lesbos, we help people to organize a Corona awareness team, to do Corona awareness in this terrible camp by themselves. There were pharmacists, doctors, nurses, they were all very well trained, but no one recognized them in the position they had. People just saw, oh, these are poor refugees, they need help, they need, I don't know what. No, they don't need. The same was, for example, I was helping to coordinate the first big wave of refugees in the end of February, beginning of March 2020. And it was mainly females and children. So the approach was, oh, we need to help them, we need to give shelter to them. But there wasn't any system in place to protect these women in private shelters from sexual harassment or anything. It was a very chaotic system. So the first approach was, okay, you come, you have winter clothes, it's not very, very cold. So in the worst case, you can stay a night on a railway station instead of being hosted by a predator. So dignity is always the first question is how to help people to regain their own dignity, and not how to see people as kind of I don't know, poor, helpless objects you need to help.
Excellent. That's very good.
Yeah. In this case, I think we'll have a double when it comes to refugees or even IDPs. I mean, we're dealing with a lot of IDPs, Yazidis who survived the genocide, and a lot of...
You mean internally displaced people, just right? Yes.
Internally. So the first question is, how can I help people to demand their rights towards the host governments? Because people have rights. And secondly, how can I help them to regain their dignity? Because if you're not dealing with a total humanitarian disaster, I mean, if you suddenly have 250,000 IDPs or refugees in a place because of a natural disaster or a war, it's just all about how to enable people to survive the next weeks. But in this long-term refugee situation, I think dignity and rights are the two central pillars we should put our work on.
That's excellent. Thank you, Thomas. Barbara, did you want to come in on the question of dignity and rights and the conceptualization of solidarity?
Yes, and first of all, I will not speak on the experience of refugees because I really have no expertise and I don't want to assume it other than knowing them, but I haven't studied this, and I have not, as Thomas has, been such an important advocate and ally in practical terms as well. So, but what I wanted to say about rights is one thing that I think in Natalia's terms we could call it anti-solidarity. So as Thomas was saying, you can't lose your human rights, right? You can be in a situation where they are not respected, but you have those rights and you have dignity. So there are people who don't respect it, but you have it. You can lose your civil rights if you have to flee or you're kicked out of the country that is supposed to uphold your civil rights. And the connection between the two is really the right to asylum. The right to asylum is the one could call it the most important right. That means that if you lose the respect of your rights in the country where you are, you have the possibility on paper to go to a country where your rights will be respected. And the undermining of the right to asylum in many parts of the world can't be underestimated in terms of its effect, because ultimately this is the reason that people's human rights and civil rights are not respected. So I would call the right to asylum in a way the most fundamental right, because it's the enabler for human rights protection. So I think many countries really need to look at the hollowing out of the right to asylum in practical terms and in legal terms and in policy terms as a serious instance of anti-solidarity that needs to be addressed.
Thank you, Barbara. And I'll just move to the last question for Thomas. And where I see that there are some questions already appearing in the chat, and then we'll take up some of these questions. I mean, there is part of our project, the Global Health Solidarity Project, is to really find ways of holding people accountable for the practice of solidarity or non-solidarity. So, especially in the refugee space that you are in, how can you see this sort of, actionable ways that we can, hold people accountable in ensuring that the dignity and the rights of refugees are respected? And I'm saying this also against the background of, a draft document, which I'm sure you're familiar with, that comes from the UNCHR, which you mentioned, about the right to international solidarity, which they are drafting and hoping this can become, an internationally accepted document, even though there's a lot of resistance against it. So what do you think, are tools that could be put into place to ensure this? Because, you've mentioned a lot of the refugees, across Europe. But also, if we think about the internally displaced people in Sudan and other places, the situation is dramatic and it is getting worse.
Yeah, well, I think there are two approaches. The one is towards host governments. Particularly refugees, less than IDPs. IDPs are still citizens of their own country, although their own government usually doesn't take care about them. So it's very difficult to deal with IDP situations, although the number of IDPs is growing extensively. If we talk about refugees, meaning people who passed an international border, and particularly refugees who are inside the European Union, they have rights. They have rights, and they very often don't know about their rights. And very seldom there is the clear political demand that questions like public health, shelter, education are basic rights. And the government has to find ways to grant them these rights. This is not charity. This is not being nice. These are fundamental rights, like equal to the rights everyone else in that country has. Okay, so the fact that this is not really done open up the field to this NGO business. I call it NGO business. So like when we had the huge refugee crisis from 2016 to 2021, 22, this is $1 billion business. and it's used as a business. It's a billion-dollar business, and because the problem is we're doing good, we show solidarity, we are the nice people. So why are you controlling the way we're spending money, flows of money, what we're doing? So we need to be very critical about the NGO business and about all these volunteer business. I don't like these type of volunteers working there with no experience, being totally non-skilled. Partly they're very heavily traumatized. They don't know with whom they're dealing. I mean, look, just as an example, you come from the middle-class family, and you've never seen anything bad. You're dealing with refugees who were tortured, who came from civil war, who lost, and then you're asking these questions. Can you tell me a little bit how it was to be tortured? I mean, this is very intimate question. Yes, I can. So these are very intimate questions, and people start because these are the volunteers doing good. So I have to answer because I'm not an unfriendly person. But this is the same question, like how has it been to be raped? So these volunteers were neither trained, nor was there any idea for what do you need volunteers? Do you really need volunteers to distribute clothes? I mean, these refugees can do by themselves, right? If you help them organize themselves. So we have to be very, very critical about what developed in the name of solidarity and transformed in this huge NGO business. And it's very, very important, as in any place in the world, to follow the money and to see how many actors are earning a lot of money out of this refugee crisis.
Yeah, that's very important. Thank you very much, Thomas. I mean, it's unbelievable how the suffering of people can be instrumentalized, and people just, and this is where I think your question of dignity, and rights is so vital. Let me just
tell you for just this one point, because this is something people don't know. In the last 15 years, humanitarian aid became a business. Of aid today is running through so-called these private funds. So banks, investment funds, all of them are earning a lot of money because rich people for tax reasons, create these foundations. And these foundations are zero responsible towards anyone. Usually you don't have even an accountancy. So we definitely don't know what happens with the money. And this money is spent in poor countries. And this leads to a lot of corruption and everything. And one has to be much more critical about the way humanitarian aid is channeled than 20, 25 years ago.
Yeah, I mean, I think you've hit on a very important point there, because I mean, the humanitarian world has become, basically ways of, channeling money that is not accountable. And
Exactly.
secondly, it is not always it does not always engage with the so-called recipients. And this is where I think, in part of Barbara's work, solidarity it differs from charity, because sometimes charity is just about underlying, oh, we are like this, and these people are poor and they need this, and we just decide and we do this for them, and this is more paternalistic. Whereas if we put ourselves on the same level with the people that we intend to stand up with, then we would have to listen to them and would have to engage with them and act respecting their dignity.
But we cannot put ourselves on the same level, because I'll always be the person with the right passport, and this acting as if we are practically equal I don't believe it creates a real equality. I mean, I always have to reflect that wherever I am, I have the better health insurance, I have the right passport, and that's true for almost everyone working in that field. What we can do, and what I strongly believe, is we should see our practical work as services and not as help. So, and you should judge the services as you judge a mobile phone. If you buy a mobile phone and you you're not grateful or thankful. So anything we're doing in the field of health, education, whatever, should be seen by the so-called recipients as a service. And if we move this on this level of services, they are the ones judging, is this a good product or a bad product? I'm not a very big fan of capitalism, but on that point, I think it's very helpful. We destroy these ideas that we can work on the same level. We are working on the same level because it doesn't matter whom I sell my mobile phone. If he's rich or poor, the mobile phone is the kind of product that's traded between two people. So I think this service-centered approach is very, very helpful and gives people the dignity to say, I don't like your service, full stop.
Right.
Or I like your service, please continue.
Well, I think that touches on what Rugare mentioned earlier on about when he said no, thank you. And there is a question here that I think, I'll just read out. He says, on the issue of refugee and immigrant health, there is an unsettling trend, antithesis or contradiction, where solidarity is breeding antagonism and anti-solidarity in the host communities. Refugees are received in the name of solidarity by some constituency in the host community. However, another constituency in the same host community, resistors, perceive a threat and start to push back. Many people identifying with the needs of the resistors engage in solidaristic targeted at the beneficiaries. How do you think that can be resolved when communities get split? And we see that often when there is an influx of refugees or displaced persons in communities. Yeah.
Well, I don't think there is any easy answer would be a lie.
Yeah.
And we see a very harsh trend towards a very anti refugee trend in Europe. And the first ones who usually start suffering from that are people with health problems. So I don't see there is an easy way to deal with this issue. I think empathy and understanding is at least something we who have neither power nor anything can do, because there is very often a very big misunderstanding about, for example, mental health problems. Where do they come from? How to deal with them? Why people act in certain ways violently or whatever in host communities, and how much that is also related with their history, and on the other hand, with very few institutions, very few people who are skilled and able to deal with these issues. But again, if we try to understand public health as a citizen's right, or a right in general, and how on a positive, how on a giving and taking way we can deal with that. I think that was going to change a lot. For example, particularly in the first and second wave from Syria, there were so many doctors and nurses being part of the refugee wave. And one already could have started working with them because they want to contribute. They don't want to just receive aid. They want to contribute. They want to give. So why was it so difficult to start on the first point of reaching Europe, cooperating with these medical professionals that on the first they work in the refugee camps or refugee institutions, and secondly, they're used to particularly also continue dealing with these issues in the host countries. But the contrary is on contrary, people are put for years into this asylum seeker system where they cannot do anything, where they lose their skills and their dignity.
Yeah, that's unfortunate. So we have time for just one question, and the question is from Jeun Noor, and she says, thanks for the talks. I'm just wondering whether solidarity could become another buzzword. the 2025 Pandemic Agreement and the EU's 2024 Asylum and Migration Pact both include solidarity as a guiding principle. Some people see this as solidarity potentially replacing human rights language in a way that could weaken mandatory obligations. What are your thoughts?
I think solidarity shouldn't be part of official papers. It's not the job of governments to decide that. This is solidarity is a concept of citizens, of non-state actors. It's not part of the, in my opinion, of the state sphere. Okay? The state sphere is a sphere of rights and obligations and so on. So I'm personally not very fond of having these words in official EU papers. Because I anyhow don't believe in that. I don't believe in this world governments can show solidarity, and I don't think it's their job actually. So I agree with the person who asked these questions. We should keep these concepts of solidarity, in my opinion, in a civil non-state actor sphere, and insist out of solidarity that official papers and treaties and whatever should be right-based.
Okay, that's an interesting approach. Barbara, I'm sure you have you have something to say because you speak about institutionalized solidarity as well. So let's yeah, Barbara.
So I think it won't come as a surprise that I strongly disagree with this. I think there's a false dichotomy between laws and solidarity. So I'll explain first what I mean by this, and then still agree with Joan that there is a risk that it becomes a buzzword. So solidarity is part of the primary law of the European Union, and to take it out, I think, would be a very dangerous move, because it would mean that there's no obligation anymore to issue policies and laws in the spirit of solidarity, meaning that we're not just calculating, we're not just saying we do whatever helps us, but we have solidarity across the union and hopefully beyond. So the question is, how do we realize this? How do we ensure that the laws and policies that are issued are actually inclusive solidarity, solidarity that maybe costs the union something, solidarity that doesn't give rise to vaccine and other types of nationalism? That's the fight we should fight, and not to say take solidarity out. I think that would be a very dangerous move. Having said this, I fully agree, and I've written about this as well with what Jeon is saying, that there is a risk that with this inflation of solidarity rhetoric, the term becomes a kind of empty signifier, right? Or that it becomes used as an argument by countries to say, our people come first. Again, this is why it's one of the reasons that this project exists, that Cesar is leading. This is one of the reasons that we're bothering everyone with this kind of analytical framework. We need a framework in hand that enables us to say, what you're doing, maybe you call it solidarity, but it's really not that. It's really something else. It's charity, or it's merely rhetorical mobilization of solidarity. It's not what solidarity means in the context of global health. We need the analytical framework to do that. And on one point, I strongly agree with you, Thomas. Of course, the heart of solidarity is in society, but society can't be, and people cannot be solidaristic in a sustainable manner if the laws and institutional frameworks aren't there that supports people. So I think the two are not in opposition. The two need to be thought in connection with each other.
Excellent. Well, thank you very much, Barbara, and thank you really, Thomas, for this, interaction. This has been very helpful, and I'm sure all our participants are grateful for what you've shared with us. And we're going to come out of this, webinar, perhaps understanding a little bit more about the world of refugees, and I hope this can also translate in our own countries and in our own context to have some form of activism and some sort of engagement on these questions. Thank you very much.